Good afternoon, everybody. Today we'll give you an update on the cases and the vaccines. Getting to some good news first. We have no further community cases of COVID-19 to report at this point. Testing's going well. At least half of the Papitoetoe High School community has already been retested. Those results that are in have all been negative, and we have some further results pending. The final small group who were outstanding from the first round of testing are being actively followed up. Every effort's being made to ensure that they get their test and that they remain in isolation for the full 14 days. Overall, the school community is responding extremely well, and again, I want to thank them for their patience and the leadership that has been shown throughout here. Nobody invites COVID-19 into their community, but when that happens and a community responds as positively as this one has, it certainly helps in our overall response. So I'll give you an update on vaccine rollout shortly, but first I'll hand over to the Director General of Health for a bit more information on today's update.
Thanks, Minister. Kia ora koutou katoa. So, as the Minister said, our numbers today are, thankfully, very much business as usual. There are the 2 new cases in managed isolation. One of those is an historical case, and we have no new cases in the community. All the regular information is about to go up on our website, including about the 2 positive cases that are siblings linked to Case I that we did talk about yesterday evening. Yesterday's news of additional cases, I know, was unsettling. Feels like another climb up on our roller coaster ride, but it does not need to be alarming. I'm confident the system is working as it should under Alert Level 1, and there is indeed a lot of work underway. Of course, our very close monitoring, our ongoing follow-up of any of our contacts who are in isolation will continue. So there are now 11 cases associated with this cluster, and all these cases are in the Auckland quarantine facility. We can confirm the genome testing for Case I, which was the first case we announced yesterday, has shown to be the B117 variant and very closely related to the genome sequence for our first cases, Cases A and B, that had an identical, those 2 cases had identical sequences, and this one is very closely related. This is what we expected, and it does provide reassurance that the cases yesterday have not appeared in the community at random. There is not another source of infection here. So both Cases A, the original schoolgirl, and I yesterday are genomically linked. Both are students at Papitoetoe High School, and both were at school on the 10th of February. We haven't established the exact transmission link between the 2, but it is likely to have occurred in a common area such as a bathroom or corridor. We do appreciate there is a lot for people to absorb around these latest cases, and we are continuing to make information available as quickly as possible and as clearly as possible. All the current information about what people need to do within the different categories of contacts is being published and regularly updated on the Ministry of Health website on the Locations of Interest page. This is something of a one-stop shop for people who may have been at those locations of interest, and includes clear instructions about what is expected of them. And of course, Healthline also has that information. So moving to the wider outbreak, you might recall that our contact tracing had previously identified a total of 126 close contacts associated with the 2 previous households, which were Cases A to H. All these contacts have now returned negative tests, except for 3 who have not been tested. 2 of these are children, young children who are not required to be tested, and others in their households have returned negative tests. There is 1 contact from the medical clinic we have not yet been able to track down, but will continue to follow up with. That was considered a low-risk exposure event. Of the 1,496 casual plus contacts from Papitoetoe High School initially from the 10th of February, 1,487 have returned at least 1 negative test, and I can say there were over 600 students and staff tested yesterday, and already 328 tested today back at the college, so getting through those second tests very quickly. Those who have all had a test have returned negative test results, except for 3 close contacts who have not been tested. Sorry, there are 3 positive cases, which are our cases E, I and J. Otherwise, everyone has had 1 negative test, There are 6 students who have not been tested. These are all being actively followed up and contact made, including visits to the household. For yesterday's cases, I, J and K, there have only been 4 close contacts identified outside the household so far. 874 people have phoned Healthline, indicating they were present at one of the locations of interest and at the relevant dates and times. And in this particular instance, as we've talked about, we are being especially cautious and are managing these people, even though they are not close contacts, we are managing them as if they were close contacts. So they will be required to stay at home for the full 14-day period and be tested at day 5 and then day 12, and they will receive daily follow-up from our public health units and others. Our national contact tracing systems are in action. Indeed, our wider public health units around the country are helping out with this follow-up of these people as well. It's a very active process, and if necessary, visits to houses are made to ensure people have the support they need to remain isolated and to access testing. There are plenty of community testing centres available around Auckland as usual. Those closest to the locations of interest are in Botany, Otara and Wiri. I understand there were some queues there this morning, so reminder that there are other sites people can go to, and also many GPs and urgent care clinics can test, and testing is free wherever you have it done. And finally, just perhaps a word on variants. We're actively monitoring the emerging evidence about these new variants from overseas, including around infectiousness, incubation periods and symptom presentation. There are questions around, of course, that have been raised here about why some very close contacts don't seem to be infected, but in this instance we've had what appears to be a very casual interaction that has led to an infection. Of course, this is just seems to be the nature of this virus, and particularly these new variants, so we'll be following that evidence up very closely. And I just want to emphasise too that several of our recent cases with this new variant have had what one might call atypical symptoms, where their main symptom has been muscle aches and feeling tired rather than typical respiratory symptoms. So I do want people to be aware of that. Sometimes people ascribe these symptoms to other things, such as post-exercise muscle discomfort, sore muscles. So if people could just keep that in mind. And in several of these latest cases, the students have not felt particularly unwell or have understandably ascribed their symptoms to something else. Wastewater testing continues around Auckland, and all of that so far is negative, aside from the positive tests we frequently get for the pipe that is draining out the jet park, as we would expect, and that acts as a bit of a baseline comparison. Around alert level changes, I know there will be a lot of interest in that. I've formally sought advice from Dr. Ian Town, the Chief Science Advisor at the Ministry, and Dr. Caroline McElnay, the Director of Public Health, both last night, and we talked again this morning, and we don't see any need in the current situation to advise around raising the alert levels. It's not dissimilar to the Northland situation we had several weeks ago, with a large number of places of interest that we successfully were able to follow up, isolate and test people to get ahead of it. Thanks, Minister.
Thank you, Dr. Bloomfield. A quick update on vaccines before we get into questions. We've seen vaccinations begin this week in Auckland and Wellington, and today the first 40 border workers at Christchurch International Airport were the first in the South Island to receive their vaccines. This passes a milestone for us, the first 1,000 New Zealanders receiving their first dose of the COVID-19 vaccine. That's a good start, and I want to extend my thanks and appreciation to the vaccinators and the border workers that have been involved in this effort so far. They've included aviation security workers, cleaners, police, customs workers and health protection officers who are screening passengers as they arrive on international flights. It's good to see the gradual scale up of vaccines being administered amongst this Tier 1 group as we had planned. As the process at each site is fine-tuned, we expect to see the numbers of people vaccinated each day slowly starting to increase. Further good news today, I can report that we've received a further 76,000 doses of the Pfizer vaccine. They were flown to New Zealand yesterday, and as with the first shipment, they are now undergoing quality assurance and checks by MedSafe. By the end of March, we're due to receive a total of around 450,000 doses, which will be enough to vaccinate 225,000 people with the 2-dose course. I can also confirm that we received a shipment of 490,000 special purpose needles that arrived into New Zealand yesterday. These will help the vaccination teams maximise the safe use of the vaccine. Making the most out of every vial of vaccine and avoiding any wastage will help us to ensure the successful rollout of our immunisation program. So, happy to open up for questions.
Have there been any problems with, you talk about the quality checks there, have there been any problems or wastage of any vaccines that have come through the country yet? Not that
it's been reported to me. One of the areas of focus for us has been making sure we can get the full 6 doses out of each vial. My understanding is that they have been able to do that. There haven't been any concerns around certainly there were no problems in getting the vaccines to New Zealand. The shipment process went very, very smoothly. All those safety and quality checks happened very smoothly as well.
Pretty quickly with the Pfizer vaccine, is there any expectation that the other vaccines scheduled for later in the year will come earlier?
Look, we'll have more to say about that when we can. Obviously, they're going through an approvals process as well. I'm just not in a position to be able to update you on the likely arrival of those of additional vaccines. I can tell you what that the Pfizer. The 750,000 courses of Pfizer, we're expecting to be spread across the first 3 quarters of the year. And so we're on track to be able to get our first quarter shipment in by the end of the first quarter. As I've indicated, it will come in smaller waves. In terms of the other vaccines, when we weren't expecting any of the other vaccines in the first quarter. When we're in a position to update on that, we certainly will do so.
So the topic of the Pfizer vaccine, there have been reports out of the US, and perhaps this is a question for Dr. Bloomfield, that now the Pfizer vaccine doesn't have to be stored in an ultra-cold freezer, it can just be a standard freezer. Is this something we're looking into? Because the implications of that would be pretty big for us, wouldn't it?
Yes, I have heard that they think it could be stored at a lower temperature rather than ultra-cold. However, the important thing is whichever very low temperature it's stored at, once it is taken out and thawed, it needs to be used within 5 days, and that's the more critical thing in terms of the logistics and the planning of the vaccination. So whether it can be stored at -70, and we have now got the freezers and the capacity to do that, or a slightly warmer temperature is probably less of an issue than just this 5-day constraint on once they're thawed.
One of the advantages of the approach we've been able to take with Pfizer is by having vaccines arriving in the smaller amounts, we actually end up having less stockpiled in our freezers. And as we scale up the campaign, if we can continue that approach with them, and we'll keep talking to them about their delivery schedules, then obviously that works to our advantage as well as to theirs.
Can I ask you about this leave support scheme that's being supplied? There's now a really large group of people that are the casual plus contacts, and for them staying at home for 2 weeks is a big deal. Having only $580 for a fortnight, that just doesn't seem enough for a larger group of people. Is that something you're looking at now that those numbers are bigger than usual?
Look, we're always looking at how we can improve support, and that's not an area that I particularly have responsibility for. My ministerial colleagues will be able to comment more on that. But what I would say is, as we've been clear from the beginning of our COVID-19 response, we are never going to be able to compensate everybody for every eventuality, for every cost that they may occur as a result of our COVID-19 response. We do work a bit on a cost share model to try and help people through adverse situations, and clearly for this group of people there will be some people who will be adversely affected by it.
Can you see why, when you're scaling up and asking people to stay at home for 2 weeks, which is more than what people are usually required to do in these circumstances, that they will find if they can't go to work, they can't work part-time, they can't do their full-time job? That's a big deal.
So we're also asking employers to be supportive as well. In my own engagement with the business community, I found the business community very receptive to that. They would rather be supporting smaller groups of people to stay at home than experiencing broader restrictions, which is, of course, one of the alternatives. So generally speaking, my message to employers is please do your bit as well to make sure we're supporting these people so that they can do the right thing by staying home.
Bloomfield, on the investigation into these new cases, have you nailed down the fact that these 11 people were contacted by Monday and might have been contacted now? what efforts were made by the contact tracing team? Was that just ringing repeatedly, or were there, door-to-door visits? Was there not an address not held by the school that you couldn't find? What was the kind of point of failure there?
So I don't think there was a point of failure. There were repeated efforts, and I've seen, for example, for this family, the log of all the calls made to both the home and the students themselves, and the challenge that there wasn't any communication established. So saying, they clearly understood that, or the student who clearly understood that she needed to be tested before she went back to school and was tested on Monday. There is also, if I look across that group, a number of them have been contacted, but still not gone out for testing. And so for some Māori or Pacific providers have already been out and worked with the family. The key thing we want to be sure about is that those students were isolating, they weren't going back to school without a test, and for those who are having trouble accessing testing, that was being supported. And for example, there are 5 who haven't had a test yet, 4 who are being tested today.
Were there any visits, or was it only phone calls?
My understanding is there weren't any visits done before the end of the weekend, but that of course is now happening.
And you said that they knew that they needed to be tested before they came back to school, but am I not wrong when they got tested when they were sort of symptomatic and they went to a community testing centre, not the school's testing centre? What if that suggests that they were just saying the wider COVID advice about getting tested when you develop symptoms rather than specifically the school advice?
Yeah, I mean, there may have been reasons why they couldn't get to testing, remembering that the youngest student here was only 13. She may have been reliant on other family members to get her to testing. The important thing here is we had put in place a protocol where no student could or staff member could return to school before without a negative test. Between 98 and 99% of those people had been tested, and we had results back by Monday. There was a small group at the end, and they are now being very actively followed up.
Pretty bad luck that that tiny group, that 1% had a positive case.
Well, you could say it was bad luck, but also, again, the thing about you can't rely on luck with this virus. That's why we had the protocol in, not returning to school unless they had had a negative test, and that's transpired to be exactly the right thing to have done.
Has any thought been given to vaccinating the school community as a priority?
No, not at this point. We're obviously looking at risk, and we're looking at the rollout of our vaccine, focusing on those most at risk, settings that are most at risk. Now, as we get up into a position where where there's a wider availability of vaccines, but perhaps before we get to the point where they're available to everyone, we will consider whether educational settings need to be thought about. We're not at that point yet. We're still very much focused on our border workers and our most at-risk frontline workers. There may be, another group between then and when we get to everybody having it, which we think about.
But this cluster doesn't meet the urgent vaccination criteria in the strategy.
No.
With 225,000 vaccines available by the end of March, who's the next category of people to be vaccinated after border workers and their household contacts? And will the sort of program immediately roll on to vaccinating those people, or will there be a sort of pause while you sort of recalibrate?
So look, the goal obviously is to keep scaling up the vaccination program. So we want to make decisions as we're going along, and as I've indicated before, decisions about who we bring in when is partly driven by how many vaccines we have available to make sure that we can keep that forward momentum going. But it will include other frontline health workers, such as those who are doing testing, those who are working in health settings where they're going to have people coming through the door and be interacting regularly with people. It'll potentially include aged care. So we'll have more information on that closer to when we start to roll out to those additional groups.
And what's special about the new needles that have been imported? Is it that they have less dead space in them, and are they reusable or single use?
I'll ask Dr. Bloomfield to comment on
Yes, so these are what's called low residual volume syringes and needles. Interestingly, though, right from the start, our nurses have been able to get 6 doses out of in most instances, out of these 5-dose vials, even with regular needles and syringes. And they worked out right from the start a technique to do that, which is to actually invert the bottle, so there was no gas getting in, being drawn up into the. If you get air bubbles, then you have to go through this procedure. So it's both quicker, and it means in most instances they are already getting 6 doses out of each vial. The low residual volume syringes and needles will make that, almost guarantee that we'll be able to do that each time.
Look,
Dr. Bloomfield, case J, do we know exactly what jobs they were doing at Kmart?
Yes, we have a good idea there. So for most of the time that she was at work, she was folding clothes in the men's and women's clothing areas. On one day, she was out the front counting people going in, and we're checking, but we're assuming that that's as part of having a restriction on the number of people who were in the store at any one time. And the other task that she was doing on one of the days was click and collect, providing click and collect products to people, and that involved a very short, more face-to-face interaction with some customers coming in. But importantly, those are people that we can trace because they'll be recorded on the click and collect.
So the counting job, was that just sort of with the clicker counting people going? That was greeting people at the door?
That was counting people as they came in.
Are you concerned about getting some false negatives from Kmart customers who are rushing out to get a test today rather than waiting until tomorrow?
Yes, so I'm not concerned about it, but the testing is, that first test should ideally be at least 5 days since the last exposure. And then we do another one at day 12 anyway. And as I said, in this instance, we are taking this very cautious approach of isolating them for the full 14 days. So even if that first test may have been a little premature, they will still be isolated and still require that follow-up test anyway.
And do you know what Kmart's doing to sort of manage the store or staff or making sure that it's safe to be open?
I don't know exactly. I did read that the store was open again. Presumably they've got quite a pool of staff they can draw on who aren't isolated as close contacts. I'm very confident that they would have gone through a cleaning process as well overnight before they reopened.
What about those students at the school? They're obviously facing a second week of disruption of the school being closed. Do you anticipate much of disruption to their learning, and what are you doing about it?
I know that with the lockdown, the alert level escalation, the school already had kicked into their remote learning settings, which most schools around the country have mastered as a result of our experience last year. While it's not ideal, it does allow young people to continue to learn from home. So I'm confident that the school will be doing everything they can to support those young people.
And just on a different topic, on the asking people to isolate, is there any means that you're looking at of sort of ensuring that that is happening? Sort of at the very beginning of the outbreak, we had, the police text that would go out to sort of ensure people were where they said they were. Are you sort of re-looking at those tactics again?
Look, I haven't received any specific advice on that. As with all things, we obviously ask people to do the right thing here and to isolate when they're asked to isolate. They're being asked to isolate for a reason, and we need people to follow the rules. It's the way we avoid widespread community spread, and it's the way we avoid having to take more drastic measures. So we do want people to do the right thing.
Yep, they do. The protocol will be this time and has been for some time because they're being treated as close contacts. And this is what's creating, because it's a big group, quite a lot of extra work, and why we're involving all the public health units around the country, because they receive daily phone calls. And if they're symptomatic at all, then that requires a nurse to inquire about the symptoms and just check and see whether that requires additional testing as well.
We'll come up the back.
Mr. Hipkins, several countries are considering a COVID passport to only allow people who've been vaccinated in light of Air New Zealand trialling their global digital travel pass. Is that something you've had any additional thought or advice on?
Look, we're not at the point of that yet, but certainly we're following all of those international developments very closely, including the work that's being done by IATA around, a vaccination passport type of system. So we're following that very closely. I suspect we will get to the point where international travel becomes much more dependent upon being vaccinated against COVID-19. Of course, before you start to introduce that as a prerequisite requirement, you have to make sure that people can actually get the vaccine. We're certainly not at that point now, but when we're, at a future point, when we're at that point, we'll give that the consideration and make decisions on that at the time.
We've also heard reports of some organisations like pubs or offices considering having their own sort of COVID vaccination passport before entering. What's your reaction to that?
Look, there is some advice being issued by MB, particularly for employers, around what they can and can't require of their staff. So, for example, if you have staff working in a higher risk environment, you can determine that only people who work in a higher risk environment who have been vaccinated can work in that higher risk environment. Where there's a public health need to do that, you can do that. Of course, then the emphasis goes on to what happens to employees who say they don't want to be vaccinated if they're currently working in those high-risk environments, and MB releasing advice to employers on how to work through that process. It does not mean that you can immediately get rid of somebody who's refusing to have a vaccine. So they'll need to also work with their own lawyers about that, and I would think similar requirements would apply if they were going to impose any restrictions on customers. I'd encourage them to get some good, robust advice about that before they made any of those decisions. Jessica?
Dr. Bloomfield, have you given any more thought as to when you may be publicly vaccinated? We saw Scott Morrison do it over the weekend. We obviously saw you take the test. As a sign of reassurance, do you think that's something that you'll look to do soon?
Yes, that's the latest advice I have is that it might be helpful for me to have it soon. But again, there's this. I'm very clear. I don't want to be seen as jumping the gun. I'm not specifically in a high-risk group, but I may be able to give you some more information about that in the next few days.
So you'd look to in the next few days. Is that what you mean? Or?
Not be vaccinated in the next few days, but at least confirm if and when I will be vaccinated.
And how do you balance that up? Because as you say, you don't want to be seen as jumping to the front of the queue, but what are your reasons for thinking it would be a good idea?
Oh, because I've had quite a lot of feedback, as has the Ministry, that people would see that as a sign of my confidence in the vaccine, which I can talk about, but is nothing like doing to follow up the talk.
I can also report to you that we've discussed this as a government as well, in terms of ministers and members of parliament, because we're aware of the important role that we have as role models out there, and our willingness to be vaccinated is something that the public will also be looking to. So as we move beyond the most immediate at-risk workforce, we will consider when the appropriate time is for elected representatives to be able to demonstrate our confidence in the vaccine by getting one. That won't necessarily happen all at once. It might be that there's some stratification there, including, for example, those ministers who interact with border agencies may end up doing it before it's made more widely available. But we're working through that because we do acknowledge that the public are looking to us to show leadership here, but they're also looking to us to not put our own desire to be vaccinated ahead of the need to prioritise people.
Would you try to include leaders of other parties, the opposition?
Oh, look, I use the phrase elected representatives quite deliberately. So this is not just about ministers. It's also about other elected representatives, members of parliament, mayors around the country who have a leadership role there, other key leaders within the community.
Further to that point, so it be expanded out beyond sort of elected officials and other trusted members of society,
That's right. So at the various points that we go along, as we start to roll out to different sectors of the community, we will be looking for leaders in those community, sectors of the community, to be helping to role model what we're asking other people to do. So we're already in conversation with some of those people, so that when we get to that point, they'll be there and ready to show leadership.
Have they put their hands up, or are you sort of actively approaching?
No, what we're proposing to do is where we are asking community leaders to come forward, we're asking them to come forward as the first, if you like, of the next segment. So we wouldn't be saying that they go ahead of anyone else. We'd just be saying that once we get to your group and the demographic that we're trying to reach there, we're asking you to be quick to come forward so that you can demonstrate your confidence in the vaccine.
Just quickly back on the financial support. Was financial assistance offered to the family of the Papatoetoe teen?
Sorry, of the
teenager from Papatoetoe?
Yeah, so there is work happening to support all of the families affected here through the school and through the Ministry of Social Development. They have set up dedicated helplines for anyone who's affected by this. There's a dedicated 0800 number that's been established, so people can ring that, they can get the advice and support they need. I also want to acknowledge it's not just government that's providing this support. So the local Countdown in New World, for example, prioritising home deliveries for those people who are at home and isolating. So the local business community is making sure that it's playing its role in supporting these people to isolate at home as well. So there's a lot of support going in there to make sure that people who are doing the right thing are getting the support that they need.
Minister, are you satisfied with the contact tracing ability right now, given that this family, this person was not, there was no attempt at a home visit, given that it was only phone calls and these failed over many, many days when we knew that everyone at the school was at risk? And now we've had all these extra cases.
Look, it is frustrating, but I also don't want to jump to conclusions as well. I know from our past experience of dealing with these that there can be a whole host of complexity and reasons behind that last kind of handful of cases. as we've dealt with this in previous testing waves. And it's hard to make sort of generalisations about that. So I think we just have to let the process continue. We're leaning very heavily on the people who are doing that work to make sure they're tracking all those people down.
But in general, would you expect home visits to be part of the kind of suite of tools that can be used,
Oh,
at the end of the day?
and they absolutely are. And they absolutely are.
Just on does the genome sequencing indicate that they would have been infected by case A and not specifically not by one of those other high school cases that we later found that sort of DVS?
So the advice we had, and I'll get the Director General to comment, is that yes, the link is clearly to cases A and B rather than there being one of the other cases as an intermediary there, but I'll get the
Yes,
Director
just to
General
add that. So to that, it's not an identical match to case in A and B, but it's clearly the closest match. And yes, the cases from the other family are not intermediaries on. And that fits with the exposure being on the 10th of of February, and the symptom onset for the latest case I. Yes.
Prime Minister, apologies if you've already been asked this, but in terms of how many frontline workers that have refused the vaccine so far, do you have a number on that?
No, I don't have a number on refusals. The feedback that I've had from on the ground is that there haven't really been any refusals, but then we'll find out more once we probably get through the bulk of them. That's where we're more likely to find out whether there are people who are reluctant and who are saying that they'd prefer not to be vaccinated.
Minister.
For the doctor, sorry, I'm just going to read this out. Cases I, J and K, is it right that you previously said that the Kmart staff were close contacts? And can you clarify whether they're not now? Why they're not now?
Yes, so two groups. So the Kmart staff is around 30 are being considered as close contacts. So they were immediately isolated and both considered and treated as close contacts. So they are workmates, share staff room, maybe have interaction during the workday. The casual plus contacts, who is everybody who might have visited Kmart between the 4 p.m. and 10 p.m. last Friday and Saturday, they are casual plus. They may not have come close to the case, but they have been treated as they are considered casual plus, and in this instance, we are taking the same approach as if they were close contacts.
What about their household members? What are those do?
The household members of the casual plus contacts can go about their business. However, if they're close contact, if the casual contact who's isolating at home returns a positive test or becomes symptomatic, then they immediately isolate and are followed up.
I'm going to have to wrap up shortly, but Jess.
Can I just quickly check, when you were talking about the milestones, you talked about 1,000 people being vaccinated, but that's just the people who are getting that first
That's
dose.
right, yeah.
So is that how you're going to count it? So you're saying it's a milestone of 1,000 people vaccinated, but you mean they're just the first batch, and that's the marker? How's that going to work?
So, no, I did indicate that's the 1,000 people, it's a milestone, 1,000 people getting their first dose of the vaccine. We do have a tracker, and we will be, as we ramp up this campaign, providing more regular updates, which will show, how many people have had their first dose, how many people have had their second dose, provide a demographic breakdown as well, so people can see by ethnicity and so on, geography. We'll be able to provide that more detailed information. Obviously, it's a pretty blank table at the moment because small number of people, but when we get to the point where we're doing thousands every day, we'll provide daily updates of all of those numbers.
Would that
Yes.
data just be in the usual sort of Ministry of Health sort of COVID-19 press release and on the pages where the other data around it?
So in the early part, the updates are more likely to be weekly, for example, because we're not talking about big numbers here. But once we get to the point where we're wanting to get everybody involved in the campaign, we will be doing something more daily to provide updates, to answer questions, and so on.
You say you're comfortable with the alert level settings at the moment, but what would predicate a change?
Look, as with all things, you can't sort of draw hard and fast rules around that. If we started to see extra cases pop up that weren't clearly connected with the cases that we're dealing with, that would always be something that we would look closely at and consider whether we needed to review alert levels with that information. But again, all of the same criteria that go into considering alert levels when we're not dealing with cases are the same as that we would consider now.
Dr. Bloomfield, just changing tack slightly, in regards to a nitrate study showing 1 in 6 New Zealanders are consuming levels of nitrates linked to higher risk of cancer. Are you aware of that, and what's your reaction to that study?
Yes, I'm aware of the study, and it didn't say that 1 in 6 are consuming nitrates. They did some modelling based on data from overseas and came up with a broad estimate. Their conclusion was more research is needed on this, and so they've actually applied for some funding for a case control study. So again, there's no testing of nitrate levels in New Zealand, there's no, that they're relying on, and there's no testing of people to check whether they're actually, or water to check whether people are actually drinking that water. So I think it's one to watch, but it's very early, and it's just an estimate based on overseas data.
We are running short of time here, so I'll just do one quick sweep of questions. Yep.
Just on Healthline, you mentioned a surge in calls. We spoke to someone last night who spent 7 hours waiting on the phone. Does there need to be a boost in staff levels there?
There's been a very big boost in staff, and a comment I didn't get to was, before I hand it back to the Minister, I thought I'd been speaking for too long, but there was a huge surge in calls. And there is additional resources. Healthline is very good at connecting up extra people, but many are from people who just want general information about COVID. Please let Healthline be reserved for people who need specific health advice or may be involved as in one of the places of interest. There is an enormous amount of information about COVID-19 and the places of interest on our website and the all of government COVID-19 website.
How many extra staff have been
assigned? I don't have that, but we can provide that for you.
Can you just clarify if all the students now need to self-isolate for 14 days, or they just need to return another negative test?
It will be return another negative test. Today is actually 14 days since the original exposure, so we will be looking to get all those negative test results back as quickly as possible, and then we will be able to advise the school around reopening.
Just on the communications going forward, we saw yesterday and last night that when there was a new community case, that was just released in a press release rather than previously in a statement like this. Is the going theory or the plan going forward that you would just continue doing that in a press release if it's part of this cluster?
Look, it just depends on the the nature of the time we find out that information. You know, for example, doing something in the evening, the threshold for bringing everybody back at night to update them is quite a high one. So it really depends on when that information is available and the nature of that information. But it'll be a combination of briefings like the one we're doing now and press statements where we want to get some further information out there, but perhaps we don't necessarily need to pull everybody back in to share that information.
Dr. Bloomfield, just a single last one on this home visit or lack thereof. Was there an issue with not having a student's address, or was that known?
No, the student's address was known, of course, through the school. And in fact, again, in efforts to contact these students, the small number, we had worked with the school to get alternative numbers. We had even, I know in at least one instance that a GP had been called to see that it checked with their contact information. And I should say that some of these students had visits from providers, and they were just working with the family to try and get the testing done. So it's not that there were not repeated attempts made through a range of channels to contact these families. In this case, there hadn't been a home visit, but the student went and got tested on Monday without going back to school.
All right, we'll wrap up there. Thanks, everybody.